Ladies and gentlemen, welcome. We appreciate all of you taking time to be here, and we especially appreciate our media partners who are here helping to deliver very important messages to the citizens of the state of Utah. As you all know, there have been recent developments regarding the COVID-19 virus, the coronavirus and COVID-19 disease here in Utah. Research has shown in other countries and across the world that preemptive public health measures are more effective than reactive health measures. Being proactive will not only help protect our own health, but also the health and safety of our neighbors, family, and friends, and those who are most vulnerable to this disease. That is why we are here today, to announce additional preemptive measures. We are confident that if Utahns heed these announcements, we will fare far better together. This is a very serious time for our state. We have many dignitaries that are here with us and people who are helping us on this issue. Let me just give you a run of show. First of all, we will hear from Governor Herbert. I will follow Governor Herbert with a little background on the decision-making process. As you know, the governor has asked me to lead the state's response to the coronavirus. We have an incredible task force that was supposed to meet once a week, and in the week that we've been together, I think we've had 5 meetings now. So that's the rate at which things are moving and changing. Following the governor, we will then hear from Dr. Angela Dunn, the state epidemiologist. She'll be followed by Harris Simmons, the chair of the Utah Board of Regents. Following the chair of the Regents, we will hear from both President Ruth Watkins, the president of the University of Utah, and President Noel Cockett, the president of Utah State University. We will then hear from Dave Wolstenhume, the commissioner of the Utah System of Higher Education, and he will be followed by Superintendent Sidney Dixon of the Utah State Board of Education. Following Superintendent Dixon, I will address you again, and then we have representatives from the Utah Jazz here to address the positive test that we received last night, and we'll go into that second portion following that run of show. So right now, I'm pleased to introduce the governor of the great state of Utah, Gary Herbert.
Well, thank you, Spencer, and welcome everybody. We're honored to have you here, and thanks to the press again to help us with messaging and getting out to the people of Utah the current situation, what we're planning on doing. I think everybody understands that things have changed in the last 24 hours in a significant way. We've had major religious organizations change their conferencing and their schedules for what they're doing with their conference gatherings. We've had the positive diagnosis of 2 of our Utah Jazz players and the cancellation of many sporting events around the country, or the restructuring of that event. Many civic events, in fact, have been either canceled or restructured because of this heightened awareness and concern about the coronavirus or COVID-19. We have taken action. We've been talking about this for some time now. We take this seriously and have done for the last couple of weeks, to the extent, as you've heard from Spencer, we started a task force. That task force designed to take a look at what's taking place around the country and around the world, and what we needed to be able to do here in the state of Utah to mitigate the spread of the coronavirus here in our state, to protect the people's health, and to help us, in fact, get through and weather this significant pandemic storm. This task force has had a depth and breadth of expertise and experience, which is designed to, in fact, help us have direction and a pathway forward of what we should be doing as a state. As has been mentioned, they've met often, 5 times in the past week, including earlier this morning, where we had a gathering today and talked about the need to have constant communication and information that's accurate to give to the people of Utah. These recommendations, if followed, we believe will help not only to mitigate the spread of this virus in our state, but to keep Utahns safe and healthy. The processes that we have in place and we're going to announce today are solid. We have the right people here making these decisions. This is being done based on good science and what we've learned from the experience of other countries and other parts of the world heretofore. We are concerned about testing. We've done some significant testing of individuals who are most at risk with the virus. And while the testing right now is not as many people as we'd like, we do have a sampling. The good news is that with the sampling so far is that very few of those that we've sampled have come back positive. So again, we'll have a direction from Dr. Dunn on that here later on about what that means. We've also been testing people who have been in close contact with other people who in fact have tested positive for the coronavirus. And so far, we are not seeing community spread of the virus. So again, that's good news. But we do know, based on the evidence we see here, is that the spread is going to occur, and so we are taking significant action here to amplify what we've already been doing. Today, we stopped making decisions based on just the hope that things will get better. We're basing it on the assumption that things possibly could get worse and the spread could continue. So we want to be not sitting on the sidelines. It's better to be too early than it is to be too late. So we're taking a very proactive position here in the state of Utah to see if we can't get ahead of this issue so we can minimize the spread here in the state of Utah. For the past week, I, along with the task force and Lieutenant Governor and others, have been emphasizing that individuals, families, employers, other organizations should begin taking proactive measures. This will help us to prevent the spread of COVID-19, and especially to those who are relatively more vulnerable, which is our senior citizens, those that have respiratory issues, underlying health issues. We can do a lot to protect them from getting the virus. I know that these things that we've talked about with just hygiene, washing of hands, not touching our mouth, nose, eyes, isolating ourselves when necessary, not going to work when sick, are things that are really mainly easy to do without much disruption. But I'm going to announce, in addition to those common sense things we've talked about, some recommendations that will be effective for the next 2 weeks. And let me emphasize that 2 weeks is what we're going to do, and then we'll reevaluate where we're at in 2 weeks to see if we want to continue, modify, make a change of direction. That's yet to be determined, but these recommendations will be in place for at least the next 2 weeks and possibly beyond. In conjunction with Utah COVID-19 Task Force and our local departments of health, we recommend the following. We want to limit mass gatherings to groups of 100 for the next 2 weeks, beginning Monday, March 16th. And that is 100 healthy individuals. If people are not healthy, they should not be involved in these gatherings. So if you feel sick, don't show up. If you are vulnerable, you should not participate. So limiting mass gatherings to 100 for the next 2 weeks, beginning Monday, March 16th. This includes church gatherings. This includes concerts, conferences, and other similar activities where people gather together. This does not apply to schools right now. We have some issues we're going to be talking about. We're going to ask Superintendent Sid Dixon to talk about the public school issues. We're going to be coordinating our school issues with our local health departments. We would like them to assess the situation with our local schools throughout the state. We have 41 different school districts. We have 13 local health departments. And the local experts, we want them to take some time to assess the situation on a case-by-case basis and come up with criteria that we can all understand that would be somewhat uniform across the state. They should go without saying, but if you're sick, you should need to stay home to avoid affecting others. That's a constant call. It's something we've said before, but we need to reiterate. If you're sick, stay home. And we ask employers to have some tolerance and understanding. It's better for them to lose a couple of days of work than coming and affecting your employees and having 50 people miss work for a couple of weeks. So if you're sick and you need to stay home, please stay home and avoid infecting others. Everyone over the age of 60 tends to be in a more vulnerable population. And so you should avoid large gatherings of more than 20 people. If you're over 60, avoid large gatherings of more than 20 people. Anyone who has an immunocompromised, am I saying that right? Immunocompromised should avoid large gatherings of more than 20 people also. If you can work from home, we've talked about this, we are actually prepared many ways of this issue of telecommuting, working from home. Now is the time to, in fact, do so. And we'd like you to start doing that immediately. We applaud all the businesses who've taken steps to help their employees work from home, and we encourage more to do so. We have the technology today that make this work and be effective. This is a time for us to try to implement or expand what you're already doing. In addition, I'm asking the local health departments to protect high-risk populations. Again, those senior citizens who are in care centers, those who gather together that maybe have underlying health issues along with being older of age, senior citizens that are requiring long-term care and other care facilities. We'd like the health department to work with them to restrict access and monitor employees and visitors for symptoms of COVID-19. So let's check before they get into those operations, those care centers, and if needs be, restrict their access. Let me just kind of sum up here that I've not come to these decisions and these recommendations lightly. This has come as we've seen this thing evolve over this past week, based on good science, based on the information that we've observed and seen throughout the world and certainly here in America. Again, we're trying to be proactive and say this is the best policy and the best process for us to go forward with here to mitigate the spread of COVID-19. It's going to have an impact. It certainly has some disruption to our economy. We all know that and understand that. That's a concern for us too, but the health and welfare of our citizens is the primary concern. And we'll get through this together, and our economy will recover as it needs to do. I'm also aware that we may have some additional steps we'll need to take as we go forward to help with the economic impact and with the health care and welfare of our people of Utah. I believe these steps, in fact, have consistently slowed the spread of COVID virus here in Utah. And I think in other areas where these have been implemented, we've seen that happen. So I believe that the steps we're taking will help us slow the spread of COVID-19 here in the state of Utah. And particularly they're effective if they're implemented early. So some think, are we pulling the trigger too quickly? As I said before, it's better for us to be too early than to be too late. So we're taking some aggressive, proactive steps right now, and I think that it is very timely and necessary for us to get ahead of this. Utahns can take comfort, I believe, that these steps will significantly slow the spread of COVID-19 here in our state. We can have confidence that these steps will, in fact, have a positive impact and help us get through this difficult time. Now, let me just add in closing. I know there is high anxiety. People are concerned. There's uncertainty about the future and what to do. We have people that are rushing down to the stores and stocking up. And Utah certainly has a history of preparedness, of being prepared. We have a program in Utah we started a number of years ago called Be Ready Utah, encouraging individuals and families and schools and businesses to be ready. People ask me all the time, be ready for what? Well, fill in the blank. It could be fire, it could be flood, it could be drought, economic downturn. In this case, it's the coronavirus, COVID-19. We need to be prepared and do what we can to be prepared. I hope people will be reasonable and rational. There are areas where we are overreacting. For example, our water supplies are good and abundant. Stockpiling water in your home is probably not a necessary thing unless you're in some kind of a unique circumstance. Turn on the faucet, you're going to get good, clean, potable water. Fighting at Costco or Walmart over different issues out there and not being friendly in the process is something we don't want to see. A run on stores and tempers flaring is not the Utah way. Again, being prepared is important. I understand that. We need to take prudent measures to slow the spread. And this is becoming what I would call a speed bump in the road, to slow it down, to stop it, hopefully, but certainly to slow it down so that we can go about our lives without having minimal disruption of our health care and our health outcomes and certainly our economy. So I think we are doing all that can be done. As I mentioned in the very beginning, We are hoping for the best, but we are preparing for the worst. It's going to take all of us working together in a spirit of collaboration and cooperation to do this. Utah has that ability. We will get through this together, and we'll have a positive outcome with minimal disruption, I believe, if in fact we work together and follow the recommendations that we're given here today and others that may come in the future. So with that, we thank you for your attention, and we look forward to working together with all of you, and we'll continue to give you updates as we go forward.
Thank you, Governor. Ladies and gentlemen, I want to take a minute to talk about the why behind and the decision-making that has gone into to those recommendations that the Governor just gave. One point of clarification that we've gotten: this does not mean if you have a business that is larger than 100 people that you need to close their doors. That is not what we're saying at all. Again, these are mass gatherings of people coming together, and again, over the next 2 weeks starting Monday. But more importantly, there's a specific reason behind what we're doing. What we know about this virus and what we're learning from other countries and the way that it spreads is that there is an incubation period of 2 to 14 days. We also know that, unfortunately, and this has been very well documented, that getting testing supplies from the federal government has been a slow process. We are increasing testing, and I'll talk about that momentarily. But what we want to do is we want to make sure that we're making the right decisions with the best available information. And because of the latency of this virus spread, sometimes we don't have the most accurate information because of maybe what is happening out there in the community, because of the slowness in the incubation period and the lack of testing that we have had over the past few weeks. The purpose, as the Governor mentioned, putting a speed bumper, a circuit breaker, to give us a chance to step back and hopefully slow the spread. What matters with this virus and with others pandemics that we have seen in the past, we know that the mortality rate decreases significantly if we get people the best health care possible. The only thing that can prevent us is we have the most advanced healthcare system in the world and the best in the United States right here in the state of Utah. The only thing that would prevent our citizens from getting world-class healthcare is if we overwhelm that system. The only way to prevent overwhelming the healthcare system is to slow down the velocity at which this disease spreads. Now, I want to be very clear on this and remember that for most of us, if we contract this virus, we will be just fine. There will be mild symptoms just like the cold that you had last week or a mild case of the flu that you've gotten in the past. For most of us, this will just be a little bump in the road. However, what we do know is that for another 15% of us, we will need more attention. And for 5%, likely hospitalization and extraordinary health care measures. If everyone gets this virus in a rapid amount of time, we will fill the hospital beds that are empty. Routinely, hospitals in the United States run at about 80% capacity. So you can see that very quickly we could fill up that 20% capacity, and then it becomes impossible for our amazing healthcare workers on the front line to deliver the extraordinary care that is necessary, and that's when we see mortality rates start to rise. So I want people to understand that the actions that we take individually, although may not affect us because this disease may not hurt us, it can have a huge impact on those who are vulnerable. And of course, we've mentioned already those over the age of 60 and those who are immunocompromised have a much higher mortality rate with this disease in other countries. Those are the populations we're trying to protect, and you and your families can help protect those populations by implementing the measures that the Governor has mentioned already. Now, I do want to talk a little bit about testing because this is the one area where we get a lot of questions, and we want to make sure that we are giving the best and most up-to-date, accurate answers. So a couple things you need to know about testing. As of 10:40 a.m. today, March 12th, the Utah Public Health Laboratory has tested 136 patients. So that is our state laboratory. We've tested 136 patients. There are an additional 24 individuals whose samples are being tested right now. These data only represent samples being run at our public health lab. There are an additional 18 Utah residents who were tested by the CDC prior to the public health laboratory becoming certified to conduct testing in state. Private laboratories have also started testing samples as well. I'm pleased to report that ARUP at the University of Utah tested 100 individuals yesterday alone. And in the coming days, we'll be able to increase testing significantly up to around 500 individuals. We're also working very closely with IHC. They're in the process of getting their tests certified. We hope to have that certification very soon. After that certification comes, they will also be able to ramp up testing into the hundreds. So we are on a good trajectory that will allow us to test far more, will allow us to test more surveillance testing throughout the community to try to detect if there is community spread and to what extent that community spread is happening. Again, the purpose of what we're announcing today is to allow the testing to keep up, to catch up with where we are so that we're making the right decisions 2 weeks from now as we reevaluate where we are right now. And Dr. Dunn is going to talk to you again about the good news. We do not have, as of yet, any cases of community spread. That is very, very important. Now, admittedly, we wish we were testing more, and we're going to be testing more in the coming days. Now, I want to continue on this a little more. As you know, we have 5 residents who have tested positive. That includes the 2 jazz players that were mentioned earlier. 3 of those cases were confirmed by Utah laboratories. The other 2 were confirmed by labs in Oklahoma. Additionally, the Utah Public Health Lab has confirmed 1 positive result of a non-Utah resident who was in the state on vacation. This individual does not count, per the CDC, as a positive case towards our total count. But however, local public health agencies are proceeding with their regular investigative process in this case. They will identify and interview close contacts, and the patients will be isolated and monitored by public health. And we'll talk more about that with the Jazz case momentarily. The Utah Public Laboratory has capacity to test up to 60 people per day now. Again, I already mentioned ARUP, and I just want to say, when fully scaled up, we will be able to test more than 1,000 individuals per day. It should be noted that drive-through testing is both underway and expanding. Utah's 3rd case was identified after submitting a sample by a drive-through location. It's important to note that that sampling is exactly the way it's supposed to happen. This person did it the right way. They used telehealth to message ahead. The doctor was able to talk to them about their history, was able to identify them as someone who was possibly who possibly had contacted the virus. They came, they were tested outside of the clinic, so they didn't expose any healthcare workers. The person then went home, the test was run, the test came back positive. That person is isolated right now, and only 1 other person was potentially exposed because of the quick action and the right action that was taken. That's what we want to happen. We know that Intermountain Healthcare will be conducting testing at 2 drive-up locations, one in Salt Lake and another at their Cottonwood Clinic, and those announcements will be forthcoming. The University of Utah also has 3 drive-up locations operating, and a 4th will be operational in a matter of days. We are working with our hospital association and others to look at the potential for mobile testing in places in rural Utah, so that we have that ability to not enter and potentially infect healthcare workers and other people that are there at clinics. Now, it's very important, though, to note, and I want to underscore this, and Dr. Dunn will as well, that if you have the symptoms of the virus, and those symptoms are very similar to the common cold, very similar to the flu, of course that includes a cough, it includes a shortness of breath, and or a fever. Those are the 3 main symptoms. Again, to use telehealth and always call ahead if you feel like you need medical attention. Again, for most of us, we won't need medical attention, and we don't all have to get tested. Unfortunately, we do not have enough tests right now for everyone in the state to get tested, or everyone who has cold symptoms to get tested, all right? But what they will do is we will triage the situation. Those who have serious symptoms in hospitals will absolutely get tested. Those, again, who have had direct contact or have traveled to places where there is a virus will also get tested. We are increasing testing, but if you don't need to go to the doctor, we don't want to overwhelm our healthcare facilities. So stay at home, use the hygiene that we've talked about, and that's good, by the way. If this is the common cold or the flu, which are much more prevalent than COVID-19 right now in the state, that is just good practice anyway, and you'll prevent spreading that. And we'll get more details on that as well. The last thing I want to say here is that we appreciate our healthcare providers. They are doing tremendous work right now. We want to thank them. They're working, many of them literally around the clock in preparation. Our hospitals, our medical clinics across the state, all of them are ramping up for the potential for community spread, and we're so grateful to have them doing that great work. Now it's my pleasure to turn the podium over to our state epidemiologist, Dr. Angela Dunn.
Thank you, and good afternoon. So as Lieutenant Governor mentioned, we do have 5 total cases in Utah, and all are travel related. All cases are doing well, and they're expected to make a full recovery, and that's a good sign. We haven't identified cases that have very severe illness, and that's a sign that we don't yet have widespread community transmission of COVID-19 in Utah. The preventive measures discussed here today by the governor and the lieutenant governor are important to ensure that we continue to limit the spread of COVID-19 in Utah. But even with these measures, we expect to have more cases here. While these measures are very important and they're helpful in limiting the spread of disease, it's important to remember the things you can do under these measures. You can go for walks in a park, you can play with your kids on the playground, have dinner with your family, you can go to the grocery store. You can continue to do the things that make you and your family happy. But of course, it is flu and respiratory season, so if you are sick, as always, stay home and use telehealth or call ahead to your provider before going in.
I'm Harris Sims. I'm chair of the Utah Board of Regents, and first I want to express our appreciation for the leadership that Governor Herbert and Lieutenant Governor Cox, who's leading the state task force, are providing to all of us in higher education and beyond. The safety of our students is just paramount to all of us who work in higher education. And we'll be announcing here in a few moments, some steps we're taking to ensure that we do all that we can to protect our students, our faculty, the staff on our campuses, while at the same time making sure that our campuses remain available for some of the critical services that they provide, including to students. Our institutions are working around the clock to slow the spread of this virus, and we deeply appreciate those who are involved providing service, who was mentioned, ARUP, the University of Utah's Health Sciences people, the many people in the system who are contributing to the solution to this. We know that lessening the number of people who are congregating, reducing the size of crowds, is really, really critical. And so we'll turn the time over to first to President Ruth Watkins, and she has with her Dr. Michael Good, Senior Vice President for Health Sciences at the University of Utah, who are going to talk about some of the things that they're doing up at the University of Utah. President.
Thank you, Chair Simmons, and thank you, Governor and Lieutenant Governor, for remarkable leadership. We are taking several important steps at the University of Utah. All of these steps are designed to support our core value of promoting health and doing our part to reduce and slow the spread of the coronavirus. So I'll give you some high points about those key steps. Beginning next week, we are moving to online classes through the end of the semester. This is important timing for us. We are alerting students now because we are on spring break right now. We are also restricting large gatherings at university-sponsored events. We are restricting travel in our faculty and our staff. Those are a few of the steps, and the university is releasing a message with more detail and also posted through our website. I'm very grateful to the hardworking and creative staff, faculty, students, physicians, and care providers of the University of Utah who are implementing new approaches very quickly, recognizing that some of these changes are challenging. Again, our actions are guided by our values, supporting health and well-being in our students, our staff, and our faculty, and our broader community, and particularly doing our part to slow the spread of this virus. We're very fortunate to have the talented University of Utah health team helping lead Utah's response to this virus. I want to give special thanks to Dr. Good and his team of care providers, and particular recognition to the staff of ARUP, who are, as has been mentioned, now able to provide testing. We're very proud to live in a place that considers the greater good and care for its neighbors, particularly the members of our communities who are most vulnerable to this disease. We will continue to keep these values in mind as we respond and adapt in the days ahead. We appreciate everyone's partnership. Thank you.
Hello, I'm Mike Good. I'm the CEO of University of Utah Health. Each year, typically beginning in the fall, seasonal flu affects all our communities here in Salt Lake City, indeed across the country and often the world. Seasonal flu, caused by a variety of viruses, comes on very slow over many weeks and months, peaks sometime during the winter, and then dissipates as we get through into spring. Think of that as a slow wave. Because of the great healthcare systems we have here, the height of that wave stays below the capacity of our health systems. We're able to take care of everyone. One of the reasons seasonal flu comes as a slow wave and doesn't get too tall are a variety of reasons, include many of us have had the flu last year, and we bring some immunity in our own system. Many of us get our flu vaccines, and that helps lessen. And we have medications, antiviral medications, that again help us combat seasonal flu and turn it into this slow and not too tall wave. Coronavirus is a new organism. We haven't seen it before. And so we do not have immunity in our individuals and in communities. The antiviral drugs that we have appear to have limited or no impact. And we have yet to develop a vaccine that helps lower this. And so communities that do not prepare get hit by a tsunami. Instead of the slow wave that we see with seasonal flu, we get a large spike and a massive increase in the number of cases. Again, think of that as a tsunami wave. And if that tsunami wave gets higher than the capacity of our health system, that's when we're unable to care for patients. And so what we're doing today, the measures that are being introduced are to help slow down the tsunami, lower it, and turn it into the slow wave that as a community, our health systems, University of Utah Health, Intermountain Healthcare, Stewart Healthcare, HCA, all of our health systems and our physicians and our healthcare providers working together, if we can keep the rate of this infection below the capacity of our health system, we're going to do fine. So these measures that are being introduced today are very important, particularly the concept of social distancing. So how do viruses, including coronavirus, spread from one person to the other? The principal route is through respiratory secretions. So an individual who has coronavirus coughs or sneezes, and they aerosolize respiratory secretions. And if someone else then comes in contact, say with their hand, and then they rub their mouth or their eye, or if they're very close, and when someone sneezes, they inhale those respiratory secretions, that is how the virus moves from one individual to another individual. And so, as the scientific community worldwide and here in Salt Lake City works to develop vaccines and antiviral medications, the things we can do now, in addition to the hand washing, staying away, staying at home when you're sick, but now we need to socially distance from one another. And hence the guidelines that you're hearing introduced today, where large gatherings of people, frequent air travel, these are some of the environments where we are in close proximity with one another and risk transmitting the virus from one individual to another, particularly in that incubation period before we know or can diagnose through testing that we have it. So please, as we come together as a community, Pay attention to social distancing. Pay attention to the guidelines that are being recommended today. And we will continue to work together to make Salt Lake City and Utah the example for the world of how a community comes together and deals with a new pathogen. Thank you.
Hello, I'm Noelle Cockett, president of Utah State University. USU is the land-grant institution for the state of Utah. That means we have campuses and centers across the state. A campus, particularly a residential campus, of which we have 3, are at a tight concentration of people. This happens through events as well as through classes. We also have people coming and going from campus. We do this in fulfilling our core missions of research, education, and outreach. But unprecedented times require unprecedented actions. And we are working towards implementing actions rather than wishing later we had been implementing more precautions. So Utah State is working hard to contribute to this lowering of the peak of infection. We are doing that through the types of things that you've heard, particularly social distancing and reducing travel. We have canceled university events, both sponsored by the university and held at the university campuses and centers, and only allow those gatherings to occur on a case-by-case basis. We have also canceled all non-essential university travel. The big one, of course, is our students. This, again, is where you have large gatherings of people who to come together on a coming and going basis. And like the U, we see that these classes can become an issue and lead to the transmission of infection. So we are actually in session now. Our spring break was last week. However, based on the input and advice that we've been receiving from the state, we are canceling classes starting tomorrow, Monday, and Tuesday, and then on Wednesday, moving our classes to online format, particularly those that result in gatherings of large numbers of students. Again, we hope to be able to continue with our core missions, but times have required us to look at other methods to do that. And I appreciate again that the state is focusing hard on reducing the impact of the infection and keeping our health care facilities going strong. Thank you.
Good afternoon. Dave Wolstein, Commissioner of Higher Education in the state of Utah. We're thankful for the opportunity to be here with you today. As you can see, you've heard from 2 of our university presidents. We have outstanding university and college presidents throughout the state that has taken this very serious. They've extended a lot of time over the last week identifying how they can continue to teach courses, but yet to be able to reduce the risk of the students in the community. That doesn't go without a lot of effort, and I applaud them, and just as importantly, I applaud their faculty and staff who are going to be working diligently over the next few days and have up to this time to be able to put classes online. For those of you that have been in that arena, that's not an easy thing to do, to be able to take a lab and try to figure out how the students can have the same type of experience and to be able to obtain the knowledge they need to continue in their education. So I definitely applaud all of our faculty and staff throughout all the institutions. Again, we have great faculty and staff that are more than willing to do that for the good of the students, and I don't want that to be overlooked. As you have heard from the University of Utah and Utah State University of what their plan is, all 8 of our institutions are moving that direction. But I would encourage each of you to go to the website to those institutions that you're connected to see what their plan is for that particular school. Some will be able to get there quicker than others. Some may be doing things a little bit differently, so I'd encourage you to look at that but the intent and purpose is to get as much of the coursework online as we possibly can so the students have access to complete and finish their education. I also want to applaud the Board of Regents for the effort and the time they put into this to try to determine what is the best effort to go, as well as the Lieutenant Governor and the Governor. It's great to live in a state that cares so much that we're taking these precautionary efforts before it gets to a point to where we all wish we'd have done something different. So with that, again, we thank you all and for everybody for the efforts that they've done.
Good afternoon. I'm Sydney Dixon, the State Superintendent of Public Instruction. I want to start out by thanking Lieutenant Governor Cox for his excellent leadership with the task force and to the Governor for leading out in our state on this important issue. I appreciate that education is at the table. I've been in all of the meetings and the phone calls and representing our vast education community. I'm so appreciative of that opportunity. Safety for our students and the adults who serve them, of course, is our priority, and that means that their health and well-being along with continued education is the forefront of our minds, so we don't take the idea of closing schools lightly. Right now, we're transitioning from getting ready for the possible to getting set for the probable. We're not making a decision today a statewide decision to close K-12 schools. That may come in the future, in the very near future, but today we're not making that decision. We want to be clear that closing a school is a local decision that will be coordinated and supported by the state. Our local health departments have been excellent at already coordinating with the schools across the state. I was on a phone call with them this morning, and we had a roll call talking about all of the schools that they've made contact with, and it was the vast majority, and they will continue to do so over the next couple of days. They're in continuous communication, and it shows that we have a great collaborative, cohesive effort being made. We did take a vote, however, as a task force this morning to add a recommendation to all schools. So effective immediately, the cancellation of all school-related out-of-state travel is recommended for 2 weeks. We know that schools have trips planned and in place, but we think this is the right move for prevention. In 2 weeks, of course, we'll be reevaluating this recommendation, and we'll see if it's still necessary. And to be clear, this is directly tied to school travel, not personal travel. Additionally, we want to recommend that the following intervention measures do take effect immediately. As you've heard, the postponement or cancellation of mass gatherings, which can include school assemblies, activities, and athletic games and functions. Consider staggering recesses and lunches at schools so that we don't have all students together in one place at one time. We need to consider staggering start times or dismissals so that students aren't entering and leaving schools altogether en masse. And then really amplifying health and hygiene prevention measures. We have tools and guidance that we put out to schools, and we have posted on our new website that teachers can utilize in their classrooms and parents and families can think about. We've been talking about hygiene forever, but we've really amplified that. We want to make sure that we do not close schools unless there's an imminent threat to our children and the adults who serve them, and we want to be very preventative in nature. Our situation is different than that of higher education. While many of our schools are able to implement distance learning through digital means, we're not capable of a full transition statewide for K-12 at this time, but we're working on it, and we're working on it rapidly. Additionally, not having K-12 children in school puts weight on families whose parents work during the day or for those in which childcare is not an option. It's a different type of social and economic impact that we're not taking lightly. We're discussing and trying to understand all of those ramifications while at the same time, again, preventing community spread. I want to emphasize that while we're learning lessons from our neighboring states, we also want to lead out and do what's best for Utah. I'm so appreciative of, again, our Lieutenant Governor Cox and the task force being so proactive and trying to engage in measures that can prevent spread instead of being reactive. In partnership with the Utah Department of Health and local health departments, we've created a three-tier system for school closures. We can put fancy names to it, but for simplicity, we're calling it Ready, Set, Go. We've been operating in the space of ready from the minute we heard about COVID-19. Our schools really amped up hygiene efforts and started thinking about what would we do in terms of food, making sure that we're caring for our most vulnerable students, working with families, how do we communicate? Well, now we're operating in the space of set, where we're working even more closely with our local health departments if and when schools should close in a very heightened time frame. At least one district, in coordination with their local health department, has already triggered to a level 3, which is go. They've closed schools. We'll be reviewing these trigger points with all LEAs, those are local schools and districts, as situations continue to change. I must reiterate to all schools, please do not attempt to close a school unless your local health officers have been working with you and helping direct you to do so. Closing a school out of anxiety or fear, and not because of a health officer in collaboration with you deems it necessary, it can have ripple effects, not just throughout your community, but throughout the entire state. We'll be sending communications out to all school leaders today regarding school closure guidance, information for educators to provide to children and families, and a variety of information to consider if a school needs to close. I want to end by just saying we have complete confidence in our local school leaders, in our families, our school boards, and our local health departments to work together to make decisions that's best for our students and our educators. Thank you.
Before we listen to the jazz and that aspect of this issue, I want to emphasize that this task force that we've put together constitutes a lot of expertise, people that not only have the understanding, but the commitment to do something. And what you've heard today is emblematic of that, and we will get through this with their help and commitment. The task force actually goes beyond who you see here today, and I appreciate the good work of the task force. I also want to recognize, though, that we have with us the Speaker of the House, Brad Wilson, and the President of the Senate, Stuart Adams. They are partners with us in this effort. Clearly, they have concerns. They're in the middle of a session here, and on short notice, they came down to join with us to show solidarity. But it's not a matter of just showing solidarity. They've put their money, our taxpayer dollars, as they prioritize correctly, into efforts here to help slow down this coronavirus, COVID-19. They've put into the budget $16 million to go to our local state health department to help them address these issues as they see a need throughout the state of Utah. We have $4 million they've put into the Emergency Operations Fund, which gives us latitude in the executive branch, in fact, to address these issues as we see a need. And they've put an additional $2 million in, directed just for the local health departments that we have throughout the state. So I just want to recognize our good friends, our partners in the legislature, and their representation here with us today.
Thank you, Governor. And yes, it is the last day of the legislative session, lest any of us forget. We greatly appreciate your diligence and the great work you're doing there. Okay, we would also like to take a few minutes to address the situation involving the Utah Jazz. Yesterday, as you know, a player on the Utah Jazz preliminarily tested positive for COVID-19 while the team was in Oklahoma City for a game. The result of that test was reported just before tip-off, and the game was canceled. The affected player was not in the arena. All players, several staff, and media members were tested, and a second player also tested positive. The Department of Health is working with the Utah Jazz to contact all those who had contact with the infected player in the recent past. I would now like to turn the time over to Steve Starks, the CEO of the Larry H. Miller Group of Companies, to provide further details and outline steps they are taking to protect fans, players, employees, and their families. And I would also just like to recognize that we have with us today Gail Miller and Kim Wilson with the Jazz. Steve?
Thank you, Lieutenant Governor Spencer Cox. We're grateful for your leadership. The task force has been tremendous with us over the past 24 hours as we have worked together very closely in this ever-evolving situation. I also want to thank the Miller family for their support. They have been connected with us and are very supportive, as always, of our players, our organization, coaching staff, and we continue to work together in this situation. This is an unprecedented time, and the situation is fluid and fast-moving. Despite that, our top priority and of paramount importance are the safety and well-being of our Jazz players, their families, our employees, and the media who cover our team, and certainly our fans and the many guests that come to our venues. We have been in constant and proactive contact with the NBA, including Commissioner Adam Silver and other league officials, as well as state medical officials and experts in both Oklahoma and Utah. Our team's medical staff is recognized among the best in the world at what they do, and they remain focused on the affected players and others who may have been exposed. Our players and team personnel, with the exception of the 2 players who have tested positive for the virus, are currently en route back to Utah, where proper public health protocols will be followed. There are no other positive tests in the group that traveled to Oklahoma City or that are coming back today. This is what we know at this time. The NBA has suspended games until further notice. We will share direct information with our ticket holders and corporate partners separately. We have asked employees who work for the Utah Jazz, Vivint Smart Home Arena, and the Zions Bank basketball campus to refrain from entering those facilities to ensure proper cleaning and sanitization. I want to be clear that our employees at this time have not been directed to self-quarantine unless they were in direct contact with the affected players or are experiencing symptoms associated with COVID-19. On behalf of the Miller family and our entire organization, we want to thank all of those involved for their support and assistance. We have the greatest fans in the world. We are confident this experience will help us to become stronger and even more unified as an organization and as a community. We understand there are many unanswered questions, and we are working relentlessly to provide information and are relying on the experts for that. With that, I'll turn the time back over to Lieutenant Governor Spencer Cox.
All right, let me just conclude, and then we can take some questions. I know this has been a long press conference. Again, we appreciate all of you who have been here today and helped us here today. As you look at these people behind me, I hope we all appreciate the incredible leadership that we have here in the state of Utah. Governor Herbert, the Speaker of the House, the President of the Senate, the leaders of our institutions of public and higher education, the leadership of the Utah Jazz, the kind of the flagship of the state of Utah, and of course the Department of Health and our local health departments who are the experts in everything that we're doing. Everyone take a deep breath. I know this is a very heavy situation, a very heavy topic, but I've always said if there's one thing I've learned in the 6.5 years I've been Lieutenant Governor, it's that the worst of times bring out the best of people. Every time we've had a tragedy, a difficult circumstance here in our state, people rise up to that situation. I want to be very clear, we're not making these decisions today because things are really bad. We're making these decisions today to make sure that things don't get really bad. That's an important message for our people to hear. We appreciate our friends in the media not trying to sensationalize what's happening, not doing things to get additional clicks or eyeballs, but making sure that your data is very accurate. I'll give you just one situation. Again, there was the infected jazz player. There was some video of that jazz player interacting with people several weeks ago before there were any symptoms or exposure. That's the type of thing that isn't helpful. Make sure you reach out to our PIOs. We have an incredible group of public information officers that can get you the right information, the right data, so that we are sharing and contacting those people who really do need to be worried about this. Again, we have the best people in the state of Utah. No state, no place in the world, there is no place in the world I would rather be than right here at Utah at this time and in this moment because of the great people of the state who always rise up. Let's take care of each other. Let's not wait for the government to solve all of our problems. We're going to try desperately, but we are at our best when we're taking care of our neighbors. Check on the elderly couple, not if you're sick, but make sure that they're doing okay. Your neighbors, your friends, those who are marginalized and those who are struggling. Let's be friendlier. Let's work together throughout this. At this time, we'd be open to a few questions. So, is Dr. Dunn here? She had to step out. Okay. Yes. Yes, of course. So the answer is yes. I don't know if we have anybody from a local health department that knows this one. I think I can try to handle it. My understanding that it was in Summit County. My understanding is that the person was from another state, I believe New York. And I apologize, Dr. Dunn had to get on another call with the CDC. She would have all of this information at her fingertips. But the answer is yes. The same precautions that have been taken with other positive tests have been taken here. There is investigative work being done everywhere that person traveled. Every person they came in contact with is also being contacted.
When was that diagnosis?
Yesterday. Thank you. I saw another question here.
Maybe Dr. Wood could answer this.
Yeah, Dr. Good.
Dr. Dunn, could you just clarify, there's many people who need some clarification on contagious testing. So we understand that
So the recommendations are for people that are symptomatic to call their health professional and seek guidance in their particular case. And as the Lieutenant Governor shared, we have some examples already where somebody called, they were able to be tested without coming into a healthcare facility and potentially infecting other individuals. We are so fortunate to have ARUP laboratories and other laboratories in the state of Utah because we have already put online hundreds of tests a day. And as those testing capabilities become available, we will begin to modify the testing guidelines. So stay tuned, and as the testing capabilities come online in this state, you can expect to see updated testing guidelines. We want to be strategic in the individuals that we test, so together we best protect the health of the community. So stay tuned, expect additional testing guidelines as our testing capabilities in the state of Utah come online.
Let me just answer that question, and the answer is no. From what we know about the disease right now, you have to actually have symptoms to transmit the disease. That's what's so important. So when the health department does their investigations, what they do is they notice the time when the person first started having symptoms, and then it's direct contact with that person. So either you had physical touching contact, or you were within 6 feet for 20 minutes of that person, and they go back and they notify every single person that has had that contact, and then those people then are asked to self-quarantine for the 14 days to see if they actually got the disease. Now, what we're hearing, again, especially with the Utah Jazz players, right? There are a lot of people that say, well, I was in the arena. This is not pass-through air, right? It only passes if you get the saliva, or I'm assuming the sweat in the case of a player, in direct contact, okay? So literally, our health department is watching the game with people from the Jazz to see any contact that those players may have had with fans after the game, or during the game, or after the game, right? So that's the type of conversation that's happening. That's the type of investigative work that is being done. But if if Rudy Gobert signed an autograph 2 weeks ago, you're fine, okay? Thank you. That is currently being investigated right now. Yeah. Okay, and I'm sorry, I'll repeat the question. The previous question was, do we know how this virus is spread? Can it be spread without showing symptoms? And the answer is we do not have any evidence of that as of now. The second question that was asked is if we know how the Utah Jazz contracted that, and we do not know that yet. Of course, there is a lot of travel that has been done by the Utah Jazz over the past, and they were in cities where we've seen increased rates of coronavirus detected. Any other questions?
Did anybody from the Utah Jazz seek testing in Utah before they went to Oklahoma?
Steve? Repeat the question.
The question was, did anybody on the Jazz team seek testing before going to Oklahoma City? And the testing in Utah. The answer to that is no, because the symptoms did not arrive until they were out of the state of Utah. So there were no symptoms that were felt or acknowledged while in Utah. So all the testing has taken place in Oklahoma.
Maybe one more question. Let's go over here. Thanks. How will the University of Utah address the work study on campus?
Yes. So we are very mindful that we have many student employees on our campus, and that issue is being addressed. Accommodations and alternative arrangements are being made when possible. And I think the best thing to do would be to go to the University of Utah website and look for the contact information. We are aware that that's a concern, and we are making accommodations for students who work on campus. Thank you.
So there has not been a final decision made on graduations yet. Again, it's important to point out that the restrictions that we're talking about right now, with the exception of higher education, who many of them will decide to go through the end of the semester since we're getting close anyway on the distance learning side of this. But we have not made a decision on graduations yet. Over the next 2 weeks, as we get more information and more testing, we'll make a more firm decision on graduations after that. Everything is being talked about now, and of course this is also happening at a national level on those big types of gatherings as well. Okay. As of now, these are recommendations, and we hope and we anticipate that people will definitely follow those recommendations right now. However, local health departments will be working with local municipalities when it comes to permitting and be making those decisions. If they need to pull a permit, those decisions will be made locally. But we anticipate, with as much press attention as this is getting, that people will follow those guidelines as recommended. And with that, we'll go ahead and end the press conference. Again, we thank all of you for your time. Thank you.